Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and today's topic is going to be all revolving around the dreaded automobile accident. Now, we're right here outside of Dallas, Texas, and there are so many wrecks on our highways on such a regular basis that it's a very common concern we have. We have patients that have come to us directly after an accident. We have patients that come to us and an accident is what caused their problem years ago, and they've been in multiple car accidents, and it's a big thing. So to understand how these injuries affect you is very, very important. And I'm going to start by just explaining what a whiplash is. So if you're sitting still, the most common accident we see is someone who stops in traffic and the person behind them in traffic does not stop and they hit them from behind, a rear end collision. What happens is an object at rest tends to stay at rest. An object in motion tends to stay at motion. So if you're sitting here like this and you get hit from behind and your seat pushes your entire body forward, but your head doesn't catch up, so it's going back as your body's going forward. And so from the side, it's like this position. And then what happens is these recoil and you snap forward. So initially you go back when you get hit from behind, and then you stop and you go forward. So that's the whiplash injury. It's also known as acceleration deceleration syndrome. Something goes real fast and then it slows down. And that whipping of the head is what does a lot of soft tissue damage. So in other videos, I've talked about postural versus phasic muscles, but I'm not going to go into that now. I'm just going to tell you that the muscles on the back side of your neck and on the front side of your neck get stretched and strained, and the ligaments between the bones get sprained. All right, so you've got a sprain, strain type of injury, and say, well, yeah, that's all fine and good, but what does that mean? What it means is we know that when there's tearing, even on a microscopic level, I mean, we're talking like this is the muscle, and we're going to tear it like this. And so now it's not quite intact. It's got a little tear just like that, right? And so that represents a muscle that's torn. Well, if it's just a stretch of the muscle and then it snaps back, and it might be a little looser than it was before, kind of like an old rubber band that you haven't used for a while. You look at it closely, it's real loose. It doesn't stretch like it should. It doesn't snap back. Well, that would be like a grade 1 of a sprain or strain. Now, a grade 2 is when you look at it real closely and it's stretched a little bit more than that, and now it's actually got tears, like the muscle or ligament is torn. And now that's a grade 2 sprain strain. And then you've got this, the occasion when a muscle that's completely intact snaps, and now it's in 2 pieces. That's a grade 3 type of sprain strain. Now, why is that important? Well, as something as simple as a grade 1 strain sprain injury to a muscle, tendon, and ligament will actually include about 8+ weeks of therapy and remodeling and healing. Your body goes through 3 phases of healing. The first phase is the reaction phase. All right, so they're all 3 R's. You can remember them real easy. The reaction phase. The reaction phase of healing is when your body says, what just happened to me? And it bleeds. It shows bruising. It swells. All these activities are just in response to that injury right now. That reaction phase of healing will last up to about 48 hours, sometimes as much as 72. Well, after that time frame and your body is no longer reacting to the injury, you can start to feel a little bit better. You can still be swollen. You can still be bruised. You can still show the signs of an injury. But your body's no longer actually actively producing that inflammation in those areas. So it stopped. And once it stops, now it goes on to the next phase, phase 2, which is the regeneration phase. That's when, just like it sounds, your body starts to regenerate the new tissue. So brand new cells, if you've got a stretched or a sprained strain that kind of does that, then you've actually got some tearing in there that happened. Maybe on a tiny, tiny scale, but tearing. And so your body needs to put new cells in there to bridge the gap as to where now it's no longer completely intact. It's still holding on, it still works, it still turns your head, it still moves, It doesn't have as much strength, and if you put a lot of stress on it, it would tear more, but your body's going to produce new tissue and it's going to start to bridge that gap. Well, then when that process finishes, then you've got a bunch of new tissues that happens in a very quick manner over a period of about 6 to 8 weeks. That's the regeneration phase. You then go into the third and final phase, which is remodeling. Now, textbooks will tell you that remodeling of a sprain, strain type tearing injury can last upwards of 12 to even 18 months, not weeks. And so that's why it is way in the future, a year after your accident, you have a spot, you go, you know, it's still sore right there. Well, that's where the biggest scar formed during that regeneration phase. And your body for all these months now has been trying to break that scar tissue down so that it's more pliable and stretchy and not ratchety with motion, but a smooth fluid motion. That's the way the muscles should act. Those actin and myosin filaments, when you contract a muscle, they grab onto one another, and then you relax the muscle, they slide. So they're constantly almost doing like this as the muscle contracts. Well, then if you throw a bunch of mess in there of scar tissue, then it no longer does that type of fluid motion, and it creates an issue. So it's very important over the first 8-week time frame after a soft tissue injury to get the proper treatment. You can minimize the production of scar tissue. You can flush out edema and swelling, get rid of all the debris. Scavenger cells can come in and help and push that stuff along. But again, that's done with proper treatment, with proper therapy. You should ice at the beginning, and you should quickly switch to heat and no longer ice the tissue because that'll slow down the inflammation at first, but then over time it'll slow down the healing process. And we want to slow down the inflammation, but we want to increase the speed of the healing process, and that's through heat. So I hope these little tidbits are enough for you to understand the importance of, after an accident, getting checked out. You might say, you know, I had an accident and I don't have any pain. Well, great, but did your body suffer an injury that didn't cause a lot of acute pain that's going to cause you problems in the future? That's a very big possibility. So hope this helps you understand the injuries associated with a car accident. We see other things as well. We see contusions on heads that cause headaches. We see concussions. We see loss of consciousness. We see seatbelt marks and seatbelt signs of lots of bruising, meaning you really took a lot of force. We see lots of pain and burns on the arms from airbags deploying out from the steering wheel. And we've seen everything. We've seen broken bones, broken ribs, broken facial bones. We've been doing this for over 25 years, so we've seen kind of everything actually walk into our door. We've seen broken bones walk into our door not knowing they had fractures. So it's important to get it checked out. And again, this is the 3 phases of healing: the reaction, regeneration, and remodeling. And once you understand that, it'll help you better get treatment, and the treatment that you need going forward. So it's Dr. Tim here with TrinityIntegratedMedical.com. If you like this video, then be sure and let me know and watch some more. And I appreciate your help. Thanks.